Knee replacement surgery is usually done if you have severe arthritis or any condition that makes it difficult for you to walk. If you are planning to get a knee replacement done or have already done it, exercises will help to restore the strength and motility of your knee. They also hasten your joints recovery after the surgery. Right after the surgery, the physiotherapist will advise some rehab exercises to help you climb stairs, walk, and carry out other daily chores. The main aims of knee replacement exercises are restoring the knee movement, strengthening your leg, helping to walk with the new knee replacement exercises. Exercises will help to improve the blood circulation to your limbs and prevent blood clots. They will also improve the knee movement and strengthen your muscles. Some of the exercises are